And joining me is someone else who has been critical of the president's pick, Tennessee Congressman Marsha Blackburn. Congressman, thank you so much for being with me.
Good to be with you. Thank you, Jose.
You said yesterday we want facts, not spin, when it comes to the new czar. What did you mean by that?
Well, what we need is someone who understands all the aspects of government and understands the delivery of health care in this affected region. And having someone with a broader experience in health care and emergency response would be more appropriate, I think, than someone like Ron Klain, who is known for being a spinmeister. And the American people are just so frustrated. They want someone who is the adult in charge, who can say, this is exactly what we're dealing with, this is the transmissibility of the disease, this is how we should go about it, and they feel as if what they've seen from this administration is indeed a crisis in confidence and a lack of ability to appropriately respond.
Now, the Congressman, you know, the fact is that that's why you have the NIH and that's why you have the CDC to deal with the medical aspect of it. But doesn't there need to be someone who knows bureaucracy so he can cut through it? And it seems as though maybe, I'm just asking, it's someone who knows how government works and where the backlogs are to go through that is maybe more important than the medical expert that already exists in the administration and the country.
You just brought up an important difference. Knows government and governmental systems and not the political aspect. And that's the difference, and I think an important one right there. How you go about coordinating the delivery of these systems. Someone like General Honore, who had helped with Katrina. There are others that have been recommended that have that breadth and depth of experience working within that system. I had mentioned former Senator Bill Frist, the former Senate Majority Leader, who's a physician who had effectively run the Senate and who also has delivered mission health care in this region of the world. Someone like that would bring a view that would be more respectable to this situation.
I want to ask you about this travel ban question. The CDC is pushing back. They say that really it could make a crisis worse if you have travel bans. I mean, for example, you know, the countries in Africa that have been able to successfully beat back Ebola didn't have travel bans.
Well, indeed, many of those countries did have travel bans. I think there are 22 African nations that had travel bans with this affected region. When you look at the CDC map of Africa and you see the affected region, you understand why they put those travel bans up. Now, let me ask you this. Does it make sense to say, oh, we're not going to have rules and laws and regulations because not everybody's going to abide by them 100%? Absolutely not. And I was talking to a group of moms last night, and they said, oh, we're not going to have a rule, therefore not implement a travel ban because not everybody's going to abide by it. If that were the way we worked in this country, we would not be a nation of laws. We would not have rules. Schools wouldn't have rules. Teams wouldn't have rules. Sports wouldn't have rules. It makes no sense, especially to women.
What rule specifically do you think there should be in place?
I would prefer a travel ban. If they're not going to do that.
How, and
oh,
you mean like
the affected regions. That's been widely discussed. A travel ban on the affected region. If they're not going to do that, if someone wants to leave the affected countries, Liberia, Sierra Leone, Guinea, then they should submit themselves to a voluntary quarantine for 21 days before they exit the country. Then they would be free to fly wherever they want to go. But you would know that they were Ebola free. We've been told time and again, if you want to get your arms around this Ebola outbreak, you have to isolate it, which is over there in West Africa, and you have to deal with it there. We're doing that. We're going to great lengths to do that. I have 1,500 constituents who are troops from Fort Campbell who are deploying to do this, and God bless them and let's keep them safe. But Jose, you've got to have an isolation period, and we do need to go about restricting these visas or doing a quarantine there or having some kind of travel ban so that we can get our arms around it and coordinate the proper response.
Congressman Marsha Blackburn, it's always a pleasure to see you. Thank you for being with me live in Nashville, Tennessee.